Hello, everyone, and welcome again to Crushing Doubts Q&A, Mondays, 6 p.m. Eastern, 3 p.m. Pacific. I'm going to be here every week, so you let me know what questions you have on mind-body issues. I'm happy to answer them all. I did want to remind everybody out there, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I will get back to you personally. I think people have seen that I'm quite responsive on these. I like to know that you guys know that I'm going to be getting back to you. And if you want to come on the show to talk with me, either on video or audio, it's www.callcrushingdoubt.org. For anybody who's watching, I'm also sometimes getting questions about how to contact me. So my email is dan@crushingdoubt.org. The reason that's especially important for me to tell you is that on YouTube, when I type out any email, or you type out any email, it erases the comment as if it's spam. So that's just something to keep in mind. If you're looking to contact me, write down that email address. So we're going to get to some preloaded questions because nobody's asking a question just yet. So I like to bring up questions that were brought up in between. Okay, this is a little bit of a longer one, so please leave it up for me. Dan C. says, I don't think I can heal if I'm always busy, some stress and overwhelmed at times at work as a professional. I worry that stress/anxiety will always be there and will get in the way of me healing. I don't think I can change my thought patterns. I worry about getting busier because I have a cognition that this will prevent me from healing. Basically, I think that the stresses of life are standing in my way. I don't even work that much, like 45, sometimes 50 hours a week. Because first of all, I will validate for you, that's not small potatoes. That's a pretty solid workload. But the thing that I would say about this, in terms of the way that I think about stress and anxiety and whether it will hold back your symptoms, is that the good news is you don't have to reduce your stress. You don't even have to reduce your anxiety. What's going to change is how you are thinking about things. And so you can change how you're thinking about things in terms of your symptoms, in terms of your feeling states in the emotions column, in terms of your doubts in the doubt column, obviously, and whether you're feeling powerful. So the three columns work whether you are in a stressful situation or not. So people ask me the question all the time, how can I get better? I can't get rid of stress. The good news is you don't have to. It's more about how you're experiencing the stress. Stress about the stress is another way of saying it. So you don't have to worry about how busy you are. I used to think that too. And my muscles used to get tensed up when I'd think, oh my God, I'm not going to get any breaks. Well, now I don't really need breaks. And it's not just because I'm not hurting. It's because I also just feel less worried about stress. So, Dan, let me know if I answered that question well enough to your satisfaction. As we know, the questions are key. You got to keep asking your questions, and I will answer them hopefully to your satisfaction. And if not, you let me know. So let's pull up another question that is waiting in the wings. Okay, this one is from Sue W. She says, a big struggle is consciously knowing that fears are a driver for chronic symptoms. However, they are embedded in the unconscious. How do we overcome the fear of the fears in the unconscious? Okay, let's leave this one up too, because it's a very heady question. I need to think about it more. So first of all, I do want to acknowledge that this is an important question because it captures something that a lot of people do struggle with. And that is that we not only have fears, we fear our own fear. So, fear of your own mind is a big part of this process. We need to do some thinking about how we're going to interact with that. But this is why I find that having a flexible, clear system that does make sense of the whole situation and does answer your questions is incredibly key. If you are going to not fear your own mind, you have to know where you stand with things. And so a big part of getting better from that fear of fears, fear of your own mind, is to learn to trust the process. But people say that all the time. Trust the process. What does that actually mean? You can't trust a process when you don't understand the process. So I would say if you don't know what the process is fully, ask again. I have a video coming up next week, actually, on the need to develop your own system within the context of the system that I'm offering to you. So My system offers the broad themes, the broad rules, a scaffolding for things, but you've got to fill it in yourself, and you've got to get to a point where you feel you can trust your own mind. So overcoming the fear of your own fears in the unconscious, that really is about the power column. It's about coming to terms with who you are and what you need and what you're going to do about it. And when you feel at peace with yourself, that's when you won't have fear even of your unconscious, because your unconscious self will be aligned with your conscious self. Sue, let me know if that answered your question. I believe you are in England. So no, you're not in England. I'm sorry. You're in Canada. I sometimes can't keep track of these things. In any case, no, wait, I mixed it up again. I don't know where you live. You let me know. But I don't think you're here live. So you let me know if I answered your question looking back on it. All right, let's load up another one. Uh-oh, we got a long one. Okay, keep it up there. Diane L. says, I am finding it hard to get in touch with repressed emotions while journaling, particularly in circumstances where there has been conflict or betrayal by someone. But I am finding if I have an inner dialogue with that person, I can feel the emotions and let out a lot of my repressed emotions. Very interesting. I say the things that I wish I could have said and get it out all in my head. I do my yelling and swearing in my head. I generally feel better after. But I have to end it from a compassionate, empathetic place, or it just becomes vicarious trauma. Any thoughts on this as a process? Okay, please leave this up. There's a lot of things to respond to in that. So first of all, a lot of people use journaling, and for many, it is useful. I want to encourage people out there, if you're not finding good results with journaling, don't worry. It's not necessarily bad. It just could be that that's not the right kind of solution for you. Journaling is especially good for unconscious emotional processing. But for some people, they just can't get to it that way. And I like what Diane's highlighting here, and it fits with what I just said. You need to develop your own system. And that's what she did here. She said, okay, that's not working for me, but this I think could. And she tried it out, and it did work. So Diane, the first thing I'd say is, this process sounds great for you. It may be really good for other people as well. And I think it's a great thing to try out. I also wanted to say it is something that I do as well. When I'm having a pain, one of the things that I do is let myself imagine an interaction or a setup that allows me to get that anger out. And that can come in many different forms. Sometimes the format is, this is going to sound bad, but I'm going to say it anyway. It sometimes can take the form of me being very aggressive in my mind towards somebody that I'm really, really angry with. And sometimes I don't need to end that on an empathetic plane. But for you, maybe you do. And I think it's good to take your experience at your word. Follow it through. Sometimes it is an empathetic experience. Sometimes it is somebody actually hearing me. Sometimes it's me dialoguing with myself and creating a good empathetic view that the other person brings to me. The great thing about your mind is you can do what you want there. And this is an example of Diane doing a good job finding her way. The things I wanted to highlight about it is that she allows there to be an opening to have an actual interaction. It sounds like it was not working for you, Diane, to just have the interaction with yourself. You needed to know there was someone else there. And even though it was an imagined version of the person that you conjured up, it allowed for you to have an interpersonal reaction. And now let me say this. When you imagine yourself back in an emotional experience, your body responds as such. Think about when you think about a time that you got angry. You can get your heart elevated. You can get angry all over again. I'm not recommending it. I think that's a good idea not to do that, generally speaking. But it's an illustration of the fact that what we imagine does become a real lived reality in your body. Then another thing I just wanted to say is that you also gave some thought as to whether you would feel good at the end. For some people, ending on that note wouldn't work well. and for others it does. So try out what works for you. All right, we're cooking through the preloaded questions. I don't know where the live audience is yet, but you let me know when you have questions. Okay, we've got another one coming up. This is from Dan C. again. I am obsessing about all the different information out there, and that alone creates doubt. Oh, this is a perfect. Please leave this one up too. I guess that's just the general rule of thumb. This leads me to talk about the fact that we had a video come out last Friday on the contradictions out there in the field. So actually, this question was asked before that video came out, and maybe even contributed to me deciding to do that. But you guys do face a lot of contradictions out there, and I want to try to clear those up. Dan C. says, if I do one thing, I am doubting that I should be doing the other thing. I am jumping from resource to resource. Should I do this or that? Well, this doesn't work. I should try that. I feel I should just quit trying, and maybe that will work. I have heard people get relief by giving up the fight. Stop trying to heal, sort of thing. All right. So first of all, I want to highlight that this captures a lot of good stuff about what people tend to experience in trying to get better. There's a lot of mixed messages. I myself am even guilty of it in a way, in that when I answer one question in one way, it could contradict another question that would be asked. What I try to do, though, is develop a system that can account for those contradictions. So while I may say one thing at one time, like if I say, okay, let yourself rage internally, the way Diane was talking about there, somebody might say to me, but when I get angry, I hurt. And then I would say, okay, listen, then it depends. We move over and we do something else. So this is why I'm really talking up the idea that each one of you is going to develop your own system within my system. If you're utilizing my system, I am honored by your trust in me. I think it will pay off. But I think you want to work on developing it kind of in the way that Diane did about that particular action step. How do you want to do it? So Danzy's asking lots of questions in here that are all very important. He's saying that just the fact that there is all this information out there causes doubt. Yes, that's exactly why I created that video on the contradictions in the field. And I think I just want to empathize with you all that the people in this field need to do an even better job acknowledging that when they talk about things. But he also says, if I do one thing, I'm doubting that I should be doing the other thing. Okay, so what I want you to do, instead of thinking there is a right thing to do, there are right things, plural, for you. And there are not helpful things for you. And you get to rule those out. So I have one of my PDFs that's available for purchase, hopefully for a relatively reasonable fee. I think they are useful. Is to make choices about which things help you. Not all of them are going to help. And the reason that I put so much information out there in a variety of ways is to give you all a chance to choose. So the action steps PDF is one of these in particular. The action steps are some things you can do in each column, but more than anything, they are ways of thinking. And some of these ways of thinking are totally contradictory. If you did them all, you would be contradicting yourself all the time. The key is not that it's not to do them all. The key is to find the ones that hit you the right way, that solve the problem that you're having. So for some people, as an example, black and white thinking is something that I've recommended that you can apply, you can dip into and utilize to back yourself up, to give yourself the sense that you are fiercely in your own corner, as I like to say, and can come to terms and settle on something and not feel not feel conflicted about that. And for other people, they'd say, no, every time I get into a black and white feeling, I develop symptoms. This is the thing. We need a flexible system because you're all different. So I'm putting out different pieces of information, and you take the ones that work for you. And just because ones work for someone else, but not for you, doesn't mean something's wrong. It just means your mind works differently. So now we're going to follow how your mind works and make that work. He also says, I'm jumping from resource to resource. Oh, wait, bring that back, please. I was a fake out. Made it sound like I was done. So he said he was jumping from resource to resource. The same is true for resources. So some resources are going to work for different people. Some people really need the research-based things, and then I might direct them to Candace Pert's Molecules of Emotion, or I might direct them to Lissa Rankin's Mind Over Medicine. So, or Bernie Siegel. There's all kinds of ways that you can go. For some people, the research just it's not what they need. They need the logic. So, I wouldn't lose heart and just quit trying and just giving up the fight entirely. Though sometimes you're pressuring yourself so much, so when you give up, that takes away that one problem. But it's just one problem. You've got to sort out what your problems are, what you need help with. It's all about asking the questions. Okay, now we can move on from this question. Thank you for your patience with me. So let's move on to the next one. Making you work double time there, bringing one back, and now another one. Okay, so this was a question that was brought up on the video that I have on the core narrative. Oh, by the way, I do want to let everybody know we are going to be, I don't think it's done yet, we are going to be creating new playlists on the site. If you haven't been to the site directly and looked at those playlists, right now they're organized in such a way that we've got the Q&As, so you can look at each and every one of them. It's just organized in a playlist. Another is the Mind-Body Connection, which that's the series where I tend to talk about my work in specific, the columns and that sort of thing. Then we have ones that are on testimonials, people who have had experiences with getting better, whether with me or not. We have another playlist that is about interviews with people in the field or otherwise. And the fifth playlist that we have at the moment is the how-to segments, which is really targeting a specific thing and how to do it. Well, now we're going to organize it also, cross-organize it in terms of playlists for the emotions column, the doubt column, and the power column. So if you are looking particularly for that column help, you'll be able to get those playlists. I just wanted to say that. So leave this up here, please. We've got a question that was brought up by Vivian on the core narrative video, which will be able to find in the power column playlist when we get to it, which should be this week. She says, have I got it right? Are you saying that if we can reframe the dominant negative theme of our life into a positive one, we get our core narrative? Is it always possible to turn the negative into the positive and change our way of being accordingly? Now, I answered this in the comments to her, but I thought it was such a good question that I wanted to highlight it here if we had time. So the thing that I'm going to say is you cannot always turn a negative experience into a positive. There's just no way to do that with certain things. With a brutal rape, that's not going to happen. With the Holocaust, that's not going to happen. With the death of a loved one, that's not going to happen either. No matter what people say to you, you can try to find some growth in it maybe, or something that something good that came out of it, but it's always going to be a negative thing. If it was a really negative thing, that's the way it is. The thing you can do, and this is the key distinction, it's not so much reframing the experience or the event, it's reframing your view of you. So if you have a negative emotional experience, you're not changing that negative experience into a positive experience. You're taking the negative view you got from your negative experience of you and turning it into a positive one. I'm going to give you an example. So trauma is a great example. For a long time, I didn't want to even think of myself as having had any trauma because I saw that as a negative. I saw it as, no, I don't want to feel sorry for myself, and I don't want to, say that I'm doing something, that is kind of pitying myself, or that I deserve something better. I just didn't really feel comfortable with that idea. But in a way, what I was doing is painting a very negative view of myself, which is if you feel bad about what happened to you, then you're bad. So don't do that. And I ended up reframing that in accepting the traumas of my life. I looked at it, and this happened partly because I wasn't getting the empathy that I actually did deserve from the outside world in a certain way and within certain relationships. And I realized I wasn't giving it to myself either. So I recognized that I could turn this negative experience not into a positive experience, but into a positive view of myself. And instead of viewing trauma as a negative thing, I could view it as, oh, I went through a lot of stuff and I survived it. Okay. I'm doing fine. And that's something I can feel good about myself. So the thing that we can shift isn't necessarily the experience, but how we think of ourselves. So I hope that makes sense. I know I've answered you already, Vivian. So this is more for everyone else. If there are other people who have questions about that, please let me know. I also wanted to say, if you're new here, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I will get back to you personally. All right, next question. We had a bunch of questions waiting in the wings. Okay, well, it's a nice and long one. That's fine. Let's see. Diane L says, do you have any suggestions for reading more about the workings of the subconscious mind? I have listened to your podcast on the subconscious mind a couple of times and need a more scientific understanding, not too complicated. When I hear different practitioners say things like your brain thinks you are angry, doesn't feel safe, or feels frightened, and is just trying to protect you, my first thought is, how do you know what the subconscious brain is thinking? How do I know what is really going on in the subconscious brain? How is this all determined and researched? I believe this is linked to a bit of a doubt for me. Okay. Great question, Diane. So I am always, I wouldn't say I'm astounded because I know how doubt works, but I'm always interested, very interested to see the different kinds of doubts that people bring up. And the subconscious mind is one that can bring up a lot of doubt. Early in my work on mind-body issues after I had recovered, I was working with a particular patient, and he didn't even believe that the subconscious existed at all, let alone that we couldn't predict what it was about. And unfortunately, with him, I was not able to help him really consider the subconscious mind existed, no matter how many times I would describe the logic of it. So, Diane, I will say this. I myself rely a lot on logic when it comes to the subconscious mind as opposed to science. But there is science out there. There are studies that show all kinds of things about the subconscious mind, whether it is studies about the effect of subliminal messaging. That's one example. Whether it is, the fact that when people are primed in a certain way, given a certain stimulus, it actually changes what happens in their minds, and they don't know it happens. So to me, these are proof that the subconscious certainly exists. Your question, though, is how can you know what is going on in that subconscious mind? And that I do understand. What I would say is that there are studies on these things as well. I'm not as well versed in those things, but we can look into them and find those studies. There are certain books that I found to be very helpful, though, with that. Lissa Rankin's Mind Over Medicine does have a bunch of studies in it that includes that. Bernie Siegel has a book called Love, Medicine, and Miracles that is also really good for that. These are some books that talk about the unconscious process. One study that comes to mind, actually, it's a woman named Ellen Langer. She was out of Harvard, and in 1981, I believe, she did a study on people, some people between the ages of 79 and 81. I don't know why she chose those ages, but she talked to people and said, I want you to pretend that it is 1959. So that would be, 22 years earlier. And she had them pretend that it actually was 1959. They watched shows about that took place then. They talked about it that way. That they were in a room that was set to look like that. I'm Mike P. Welcome. I will answer your question shortly. And in this study, in the Langer study, all of their vitals changed over that time. Well, remember, vitals are largely subconscious. We've got heartbeat, we've got breathing. These are things we do without even thinking about it. So there's all kinds of proof of that. But again, I pointed you in the direction of some resources. I will say this. I don't know if you can trust this or not, but a lot of psychological theorists have followed the logical implications of what is happening in that subconscious mind. And it's the group of us together, the collective, that has put together a lot of ideas about how this works. That's how we got terms like psychological defenses. We watch it happen. So, what we'll have to do, Diane, is figure out what's going to solve the specific doubt for you. We got to keep asking those questions. So I hope I did that some justice, and we'll get back to you on more. So let's get to Mike's question. Welcome to the show again, Mike. Thanks for stopping by. Mike says, hey, Dan, I am still a perfectionist through and through. You said I don't need to change my personality or stop being a perfectionist to ease tension in the body. I just need to change the way I relate to myself. Can you elaborate more on that idea of relating to the self? Is it being more kind to myself, allowing these perfectionistic tendencies to just be there without judging myself for being that way? Mike's a pro. You basically answered my question. You answered your question. So let me highlight what you said that I think is good. Yes, in the end, a lot of what we are doing is to not judge ourselves for how we are. So perfectionists are not only perfectionistic, but they're perfectionistic about perfectionism. They don't think they should be. So they're criticizing themselves for it. And this is easier said than done. I'm not saying it's easy to stop criticizing yourself, but this is power column work. In the power column, that core narrative is meant to bring the knowledge of the body so that you can start actually empathizing with yourself. I have all kinds of qualities that I used to criticize myself about. As an example, I can be on the sensitive side sometimes. I used to criticize myself for that. And I wasn't even alone. Other people criticized me for it. And to me, that's not fair. And not just to me. That sounds like I'm being sensitive there. Pretty hilarious. But the reality is the thing that I really needed to get to was to recognize that I don't need to judge how I am. Not at all. I got to be sensitive because I have a very sensitive apparatus because I had to sense what was happening in my environment and what was happening around me. So I don't judge it. So what I would say, Mike, is let's have you think about how did you even get to be perfectionistic? There are reasons for it. And it's not some flaw in you. Meanwhile, here's another way that you can not be critical of yourself about it. There's an upside to everything. However you are, there's an upside. So this perfectionism has led to a lot of good things in your life as well. If you're not judging yourself, it won't lead to a mind-body symptom. Mind-body symptoms, they come from 3 different sources. No big surprise here. It's the 3 columns. Unconscious emotion or conscious emotion that hasn't been pinpointed. Doubt. And the power column, whether you're feeling good in relation to you. This one sounds to me like more of a power column one to me. So keep the questions coming, guys. Let's bring up another question that we had waiting in the wings. I think we have another from Diane. Diane is, she's great, by the way. You're all great in particular ways, but Diane brings a lot of information in her questions because she's very interested in helping everybody move forward with things. And so, some of it I'm sure is she wants to get her questions answered, but she also is quite generous in trying to help other people figure out these things. So leave this one up because it's another long one. I believe with mind-body changes, there can actually be physiological changes. And just wondering if you agree. Oh, absolutely. If so, I am guessing that when you address the mind-body issues that your physiology will change and heal. For example, if you have pain that has immobilized you, your muscles have probably atrophied and weakened. So these people may not fall into an overnight cure, but as you get moving again, the muscles will start to do their job again. Just curious whether there are physiological changes. Yes, absolutely there are. Although it's interesting because I think what you're saying is a little bit different than how I thought you were saying it at first, Diane. Mike, I'll get to your question in one sec. I thought what you were saying is when your mindset changes, your physiology changes. And that's true. Your entire physiology changes moment to moment, second by second, depending on what's happening. 1 minute you're happy, the next minute you're angry. That's a completely different physiology. But I understand now in reading further into the question, Diane, that what you're talking about is, does physiology change over time? Well, yes, it does. When I had 8 years of back pain and I wasn't being that active, that those changes happened for, I would say, purely physical reasons, just because I wasn't exercising enough. So you're saying, are there actual physiological changes separate from that? Well, there are some very interesting studies that show that if you visualize doing a certain activity, you actually gain strength in those muscles. So if you visualize, for example, playing guitar, which I do, and actually if I can't play guitar for a long period of time, I do visualize, because it keeps the neural pathways going, but it also keeps your hands from atrophying as much. Because what's happening is the mind is maybe flexing those muscles, I don't know, but it's keeping the pathways open. So I would say that there are physiological changes. How much is that sort of thing or not is hard to say, but I think that's a great question, and we should keep looking at it. I did also want to say, for any of you doubting out there, that atrophied muscles tend to come back very quickly. If you just start exercising, you'll be back on your feet within 2 weeks, probably. It's really no problem whatsoever, and that's not the way people tend to talk about it. All right, back to Mike's next question as a follow-up to those questions. So those judgmental thoughts about my negative traits will always pop in my head automatically. Is the idea to just let those thoughts go and not take them too seriously? Yes and no, Mike. I want to give you more help than that, because I think that wouldn't be helpful enough to you to just say, yeah, just let them go. Because if you could have, you would have. You could probably do some of that. There's something in cognitive behavioral therapy called thought stopping, where you recognize you're having that thought and you just redirect yourself. No, I'm not going to do that. So that could be part of something you do. But I really think that the power column is about understanding your trauma, understanding the basic traits of you, so that you can actually be less judgmental. So I hope this doesn't sound confusing. This is one of those times where maybe a seeming contradiction is out there, but I want to show how they actually fit together. Your first question was, do I not need to change my personality? Do I need to change my personality if I'm going to get better? And I said, no. You just have to change your perception of your personality, and your judgment of it. But at the same time, you also can change that personality some by using the power column. So there's many, many ways to get better. You can get better if you find you can't change certain parts of your personality, or maybe you don't want to, like you don't want to change being a goodist. You don't have to change anything you don't want to, but you also aren't stuck with everything that you have. And the way that you can get unstuck is to understand it in the context of trauma and that traumatic experience and what you're then going to be able to do with it. Okay, we've got a question from Rhonda Galone. Welcome back, Rhonda. Good to see you again. As my mindset is changing and I'm having good days here and there, why do new symptoms pop up? Okay. So Rhonda, this is a question that I'll probably need some follow-up from you about, as some input about this, because symptoms can pop up for many different reasons. The most organized and easy way to talk about it is that symptoms can pop up for any of the three columns. So what we want to do is look through them. I'm going to give you examples but we may have to follow up to see specifically why are they popping up for you. So as your mindset is changing and you're having some good days, it could pop up for any of the three reasons. Let's take the emotions column first. You could have a theme where when you have good days, the people around you who are supposed to be loving to you don't notice or feel happy that you're having good days. Well, then, boom, a good day leads to a symptom. So it's not always bad things that lead to symptoms. Could be good things. You have to keep track of your emotional themes and see if that's the answer. In the doubt column, an example of why symptoms could pop up when you're having good days is that doubt is fighting back. It's losing ground, and it wants to get you worried again. And so it's pushing back against the progress. If I had to guess, that would be my number one answer for anyone, generally speaking, that as you make progress, doubt is going to try to push back and get you into a situation where you're going to start to doubt again. It also could relate to, this is also doubt column work, anxiety that comes up around getting better. You know, what if it doesn't last? What if I get better and then I get hit with new symptoms? Won't that be crushing and awful? You know, fear and your imagination can run all kinds of places. So that's another reason symptoms could pop up when you're having good days. In the power column realm, it could be that you're having good days, but at some level you don't feel that you deserve them. You know, it's not that other people are not happy about it, but maybe you yourself don't think you deserve it. You're going to need to look more deeply at your core narrative and at the power column to see whether that's coming up. So those are three types of examples. But again, I think the thing that we're learning again and again is that there are many, many reasons for everything. We need a flexible system that doesn't contradict itself in the key ways. Really, my system to me doesn't contradict itself. It has different applications for different types of people. And I'm going to keep talking about that again and again so that you guys can get a good sense of that. We have a question from the Mind Over Weight podcast. I like mind over almost anything. That's pretty cool. And I don't know if you were here for when I discussed the fact that actually weight loss can relate to mindset. So that would be interesting to talk about if that is of interest to you. But here's the question you're asking. Worrying is the culprit for me, which is a lack of faith in a positive outcome. Worrying 24/7 keeps me in fight or flight mode, leading to physical discomfort. I see why you discuss power. Yes, that's it. Before I even got to your last sentence, I was like, oh, this is power column work. And you recognized it just in writing up what it was you were saying. So I'm glad you're seeing that. And I'm sure you're starting to get some things out of that. So this is important. If you're going to get somewhere with a personality that's always running the same way, that personality is going to lead to a physiology that is always the same. And so, yes, you're right that if you're worrying all the time, power is the way out. Once you feel more comfortable with yourself and don't feel that you're in danger because of that good relationship with yourself, that's when the worrying can start to change. The worrying is, in a way, a mind-body symptom in and of itself. Because remember, the brain's part of the body. If you're worrying and it's running through your brain, well, that makes a big difference in how things are going to play out. So your mind will start to shift when the power column starts to shift. You will start to shift. I just wanted to note, the Mind Over Weight podcast says, yep, I actually lost 100 pounds by addressing the mental emotional aspect. That's fantastic. And I want to highlight two things in that. And you know more about this than I do, probably, because you've experienced it yourself. Sometimes that relates to when people are eating emotionally and the intake of food has gone up because of emotional reasons. But I think what we're both talking about is a different aspect, which is that when you are not happy, you don't metabolize things as well. It's a whole different physiology. And so it really is true that when people are happier, they tend to lose weight. Along with that, just an interesting little fact is that when you smile, it uses more muscles than any action in the entire body. And that means it burns a fair amount of calories, actually. So when you're smiling, you actually burn some calories. I'm not saying that is, you don't just lose weight by just this the whole time. But it is the case that happiness does correlate. That was just an interesting fact that goes along with it. Now, Rhonda, responding to what I said, yes, what you said about anxiety does creep up in my little mind. LOL. Thank you. Yes, absolutely. Anxiety about getting better, or even self-consciousness about getting better, is a big part of things. Self-consciousness, actually, it's making me think I should write this down to do an episode on self-consciousness and its way of interacting with us. So we're coming up towards the end of the show today. If anybody wants to get a question in, I'd ask it now. You can certainly ask me later in the comments, and I'll get to you. Or if you're working up the courage to ask, you can come to me next week. So let's get to another preloaded question then, I guess, if we don't have another one in the chat. Okay, Diane, bring in the heat today. Okay, many people with mind-body symptoms become depressed, and I'm wondering if you feel that depression itself is a mind-body issue or if it's more complicated than this. Is it only a mind-body issue if it's associated with other mind-body issues such as chronic pain? Can it be idiopathic? Meaning, does it only relate to that specific person? Is it, basically idiosyncratic? Or linked to a chemical imbalance and not mind-body? Okay. Great question. Please leave this one up here. It's a complicated one. I think that depression can be a mind-body issue. I think that I would say all of depression is at least partially a mind-body issue, because depression happens in the body. I mean, not to be trite about this, but the fact is almost everything is a mind-body issue. Your brain is working all the time. Your body's working all the time. And they have direct interactions with each other. So this is a way that you can pretty much see that the mind and body are always working. And so anything in depression is going to be that way. There are specific types of depression. They call it vegetative signs of depression, when there are things like loss of appetite, really big physical changes that come up with depression. Those ones, I would say, tend to be very mind-body related. And those are the most severe kinds of depression, actually. So it's interesting. But depression also involves thinking. And your mind-body experience can change thinking. So, what thoughts you have, depressed thoughts you have. I'm going to get to there's a question from the Mind Overweight podcast, and I will definitely get to that. So sit tight with that. There are ways in which these issues play out with depression all the time, and that includes your thoughts. The thoughts that come up relate to the other thoughts that you had. One thought leads to another. And so your mindset is key. Now, the question, is it only a mind-body issue if it's associated with other mind-body issues such as chronic pain? No, I wouldn't say it's limited to that. I really wouldn't. And I think, I guess I'll say this. I don't know how far this extends yet. I deal in science and logic. And if something contradicts something, not because it's unique to one person and not another, that kind of contradiction is fine. If it contradicts facts and logic or science, then we have a problem. And I think that we're still finding out more about this. I do think it can be idiopathic. Sure, it can be linked to a chemical imbalance and not mind-body. People do have that. But it's a complicated thing. And I think what we want to do, if we can deal with the columns, people's experiences become much clearer, and then we can find out more about these realities. This is another reason I think my system can be particularly useful. It clears up some of the complications, and then we can see what there is to see. So the Mind Overweight podcast is asking, do you work with people one-on-one? I do. I do have limited availability. There's a lot of demand for it, but you can contact me at dan@crushingdoubt.org, and we can see when I can get you in. I have a wait list at the current time. Did want to let you all know that there's 2 other potential ways to work with me that have been coming up recently. One is, many of you probably saw the episode with Daniel where I did an actual session with him. And I'm going to do the second session of a 4-session consultation with him right on the podcast. So that's another way that you can come on in a more cost-effective way, obviously. But another thing is that I've started up a weekly group that people can dip into to get their questions answered. And if you're interested in that, just let me know. That is going to be Fridays at 12 p.m. Eastern. I try to set a time that would work for California time and European time, because I've got those are kind of, that's the broad swath that I usually get, and hopefully it can work for people on the other side of the globe as well. So thanks all for these great questions. Please don't hesitate to send me questions if you are not going to be able to attend and you want to get a question answered on the Q&A. As you can see, I get to a lot of these questions that we do preload, but I appreciate people showing up and asking their questions, and I hope it was of use to you. So again, if you haven't already, click subscribe, ring the bell for notifications, hit like if you like what you're hearing, and put your comments below, and I will get back to you personally. Thanks again, guys.